I'm coming here looking at my computer. I'm going to close it for HIPAA privacy. Now I'm disinfecting my equipment. Okay. I'm going to disinfect my hands. I'm going to close my curtain for privacy. Hi, sir. How are you doing?
Hello, how are you?
Good. My name is Shakray. I'm going to be your student nurse today. Can you state your name and date of birth for me?
Craig Smith, November 13th, 1954.
Okay, I'm going to check your wristband. Okay, everything looks good. How's your pain level right now? 0 being no pain, 10 being maximum
Zero,
pain.
no pain.
Okay, do you have any allergies, any type of medications, food, anything we need to know about?
No, I think I'm healthy.
Okay, great. So today I'm going to be conducting a head-to-toe assessment on you. Do I have your consent for that today?
You do.
Okay, if you could just go ahead and read the statement for me.
I, Craig Smith, agree to having this health assessment performed and videotaped. This is in addition to the critical elements, obtaining patient consent for this assessment.
Thank you very much. Okay, so you could take your glasses off for me. Okay, good. So now I'm going to start off. I'm inspecting your scalp area. You don't have any hair, so there's no hair distribution. But I'm looking at your whole scalp. It's of good hygiene. There's no lesions, wounds, abnormalities, or edema. I'm now looking at your left and right ears. They are of good symmetry. Now looking at your left ear here, I don't see any type of lesions, wounds, abnormalities, no drainage or foreign objects or hearing aid. In the left ear, now looking in the right ear here, same thing, no lesions, wounds, drainage, abnormalities, foreign objects, or any type of hearing aid in the left ear. Looking at your face, I don't see any type of edema, lesions, wounds, abnormalities. I'm looking, your face is of good symmetry. Your eyes are not bulging. Your eyebrows and eyelashes have good hair, good hair distribution. There's no, as far as your eyelids goes, there's no ptosis with that. I'm now looking at your nose. It's of good symmetry. I'm going to pull down your eyelids here. I see, looking at your conjunctiva, it's a good red color. There's no drainage with that. I'm now going to grab. Okay, so I'm also looking at your pupils here. Your sclera is of a white color, and your corneas and your right and left eyes of a smooth, shiny, and transparent. Okay, I'm going to look over here to your right eye. It does dilate normally. It's of 4 centimeters, and it's a brown color. I'm now going to come over here to the left eye. Does constrict normally. Is of a smooth, shiny, transparent. The cornea on that side, 4 centimeters. Okay, so now I'm going to check for accommodation with your eyes. Okay, if you follow the pen light, I'm going to bring it in closer. Okay, your pupils do constrict. I'm going to bring it out. Your pupils do dilate, so your eyes do have good accommodation. For this health assessment, I won't do it, but I'm just verbalizing it, that corneal nerve 2, it's going to be doing the Snellen chart, testing for visual acuity. Cranial nerve 3, I'm now going to check for any type of nystagmus. If you could just follow this pen light for me. Okay, great. You have no abnormalities or nystagmus going on. Next, going to be checking for cranial nerve 7. Can you smile for me? Show teeth. Frown. Puff out your teeth. Cheek. Thank you very much. You did that voluntary. There was no abnormalities with that. So everything looks good there. That was checking for cranial nerve 7. Okay. So up next, if you could just go ahead, I'm looking at your nose. It's of good symmetry. If you can just put your head back for me, please. Okay, checking into your nose. I don't see any drainage, leakage, wounds, no epistasis. Okay. All right, if you can go ahead, looking, I'm gonna check your oral mucosa. If you open your mouth for me, you have all your teeth. Go ah.
Ah.
Okay, great. Can you wiggle your tongue left and right for me? Okay, great. That's checking for cranial nerve 9 and 10 there. So everything's good with that. Okay. Can you open your mouth one time for me? Go ah.
Ah.
Okay, that's cranial nerve 12. That's what we do with that. That's just me stating the gag reflex. I'm not going to do it for this health assessment today, okay? Open your mouth one more time for me. Looking at, looking at your tongue, it's of a smooth color, red color. There's no lesion, wounds, or abnormalities like that. Your teeth is of good hygiene, okay? All right. So next, moving on, what I'm gonna do is, can you go ahead and take off your robe for me? Okay, great. So looking at your face and neck area is a good symmetry. I don't see any abnormality, lesions, or wounds. I don't see any type of edema. I'm now looking at your, now looking at your thorax precordium area. Same thing. I'm looking at your breathing right now. It's of a good normal rhythm. I don't see any type of no nasal flaring, no lip pursed breathing, nothing like that. You don't have any type of edema, lesions, wounds in the interior, your interior chest area, nothing like that. If you can turn over this way, I'm looking at your posterior chest area right here. I do see a series of moles here, but no other abnormalities, lesion, wounds, or edema in the back side. Your spine is aligned correctly. I don't see any type of lordosis or kyphosis of the spine. Okay, no abnormalities. Now moving forward, I'm looking at your shoulders areas here. I'm inspecting that same thing. I don't see any type of abnormality, lesions, or wounds. Looking, at your elbows here, your joints. Same thing, moving down, yep. Your forearms, thank you very much. Okay, if you can, now gonna check your nails on both sides. They are of good hygiene. I don't see any abnormalities with your nails, your nail bed or your fingernails, no abnormalities or jagged edges. I'm checking for capillary refill. They are less than 3 seconds here. So everything is good there, okay? All right, so next, moving further down to your lower extremities area. Same thing, I'm checking for any type of abnormality, lesions, or wounds in your lower extremities, your kneecap area, knee joints. Moving down, same thing, inspecting that, your shoes. Okay. Thank you. Toenails are good hygiene. Checking for a capillary refill. It's less than 3 seconds for all of this, okay? All right, so now palpating your, before I do that, I'm going to disinfect my hands again. Okay. Great. Sorry. Now I'm palpating your skull area. It's normal cephalic. Now looking at your ears, symmetric, no abnormalities, lesion, wounds, or no abnormal warmth to them. I'm palpating your sinuses right here. Do you feel any type of tenderness, anything like that?
No.
Okay. This is your temporomandibular joint. Go ahead and open up your jaw for me. Okay, close it. I'm going to palpate your lymph nodes now. Your submental, submandibular, preocular, postocular, occipital, anterior cervical, posterior cervical, supraclavicular. Okay, and back here, I'm gonna check for your trachea. I'm coming around the back from the front. No abnormalities with your trachea or nothing of that nature. Okay, next, I'm gonna check for cranial nerve 1. Can you close your eyes for me? I'm gonna check your sense of smell. Smell that?
Yes.
What is that?
What does it smell like?
Yes, what does it sound like? Sorry.
Smells like alcohol.
Okay, you are right, so your sense of smell is good. Next, I'm gonna check for, cranial nerve 8. Okay, just repeat after me the 2 words I say. 1, 2.
1, 2.
1 way.
1 way.
Okay, great. All right, so your sense of hearing is good. Next, I'm gonna check for cranial nerve 5. Also with this nerve, we would check for corneal reflex, but we're not doing it for this, okay? Just verbalizing it. All right, cranial nerve 5. Can you feel that?
Yes,
Can you feel that?
I can feel it.
Can you feel that?
I can feel it.
Okay, great. So you're all good with that. With cranial nerve 5 there. Next, can you clench your jaw for me? Here, bring down. Great, that is good. Thank you very much. So your cranial nerve 5, that concludes that. Okay, next I'm palpate, no abnormalities, nothing like that. Can you move your head left or right for me? Move your head left or right. Thank you. Shrug your shoulders up. Great. You have good reflex on that. That's cranial nerve 11. There's no abnormalities with that. Moving on, I'm palpating. I don't feel any type of your thorax, don't feel any type of abnormalities, lesions, wounds, or pulsations. Okay, no bony promises, no edema. Moving down. Let me check for your carotid. This is your left. Your right here. And the reason why I don't do both at the same time is because I wouldn't be able to, it could affect the pulse.
Got it.
Okay. Moving down here, joints, all that, I feel good. Okay, if you can put your arms on my, go ahead and put your arms out like that for me. Thank you. That's your brachial. That's your brachial right there. That's your radial. Okay. All right, so looking at your breathing, can you go ahead and put your right arm over your left arm? I'm going to check your respirations, okay? And starting now. Okay, so I got your respirations pretty fast today. I have it at 28. So you're feeling okay and everything?
Yeah, feeling great.
Okay, yeah, they're kind of fast, so it's definitely high. So, okay, so moving on there. So next I'm gonna move on. Actually, I'm gonna fill back here. All right. I'm palpating back here. I don't feel any abnormality, lesions, or wounds here. Can you say 99?
99.
99?
99.
Okay, great. That vibrates equally. No tactile freeness, nothing that I felt.
Okay.
Okay, I'm gonna now check for your, and actually before I move down to your lower extremities here, can you grab that for me? Okay, thank you. Equally, bilateral, equally strong there, 5 out of 5. Can you pull? Okay, push. Wonderful, 5 out of 5, so your upper extremities are working well. I'm now gonna palpate your lower extremities here, checking around the kneecap area, no abnormality, lesions, wounds here. I feel for your, it's your popliteal pulse here. Feeling further down here. This will be your posterior tibial here. Okay. And here on the top of the foot here, that will be the right here will be the dorsalis pedis. Okay. Can you push? Push for me.
Pull or push?
Pull. Sorry. Push. Push. Push down. Okay. Pull up. Great. 5 out of 5. Equally bilaterally strong for your lower extremities, so no issues there. All right. So next, what I'm going to do is I'm going to auscultate. Okay. All right. So next, what I'm going to check for, this is your aortic second right second right intercostal space. Okay, that's S2 that I hear. Next, moving on, is the pulmonic. This is your second left intercostal space here. Herbs, right here. I equally hear S2, S1, third left intercostal space. The tricuspid, fourth left intercostal space. And here is the fifth. This is the mitral valve. Fifth intercostal, fifth midclavicular space. And I'm going to time this for a minute. Starting now. Okay, great. So your beats per minute is at 74, so you are at normal range.
Great.
Okay, so next what I'm gonna do, also I'm just gonna verbalize very quickly that I would, for the murmurs, okay, I would just place them for this self-assessment. I'm not gonna do it, but just verbalizing it. This would be the aortic valve for the murmur. This will be the pulmonic valve. This will be Erb's point for the murmur, tricuspid, and then mitral valve for the murmur if I would hear any type of swishing or verbal, swishing or any abnormalities. So that's where the murmurs will go. Okay. Next, I'm gonna percuss. Okay. Percuss your lungs. Okay. Okay, resonance in the anterior chest area. Okay, resonance in the posterior chest area. Okay. All right. Next, I'm gonna auscultate. Okay. Go ahead and breathe for me. Okay. Bronchial, breathe for me. Breathe. 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 Bronchiovascular, breathe. Okay, go ahead. Okay. Okay, vascular. Breathe. Put your arm up for me. Breathe. Breathe. Vascular. Okay. Breathe for me. Breathe. Okay, that's bronchial. Breathe. 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 Bronchiovascular. Right, left one. Breathe. Vascular. Breathe. Thank you. Vascular. Okay. Okay, next I'm going to look at your abdomen. If you can go ahead and lay down for me. Okay, Dad. Yep. All right. So I'm looking at your, if you can go ahead and put your knees up for me. Okay, I asked that so you don't have any type of muscle guarding, anything like that. Looking at your abdomen area, it's of good color. There's no abnormality, lesions, or wounds. I don't see any type of ostomy bags or nothing of that nature. Okay. There's no perturbance. Your abdomen is of a normal shape. All right. I'm now going to auscultate. I'm now starting in your lower right region. Moving up to the lower left region. Moving over to the upper left region. This is all normal active. These are all normal active here that I'm hearing. Okay. Next, what I'm gonna do next is percuss. That's what I'm gonna do next. Yes. So, all right, starting here. Or moving up. That's the lower right. Excuse me. Moving up. Upper right quadrant. Coming over. Upper left quadrant. Lower left quadrant. So all that was tympanic, nothing abnormal with that. Okay.
Good.
So next, what I'm gonna do now is I'm gonna palpate. We normally would do 5 to 8 centimeters, but for this, I'm just verbalizing that. That would be checking for any type of wounds or any type of masses or anything like that. So I'm gonna inspect, starting off in the lower right quadrant. Don't feel anything. Everything seems normal. Coming over, that's their upper left. Moving over to the upper, that's the upper right. Now coming over to the upper left, I feel nothing, no abnormalities. Now come over here to the lower left, no abnormalities with that, okay? If you can go ahead and sit up for me, sir. Okay, just gonna have you turn this way. I'll check for your costal vertebral. Any type of tenderness, sir?
No.
Okay. Oh, I'm gonna check for one more thing. If you could just lay back down for me very quickly, sir. Sorry, just really quick. I'm gonna check for aortic bruit. Okay. Okay. Good. So I don't hear any swishing or no abnormalities with that. You can go ahead and sit up for me. So that is all. That's going to conclude, sir, our health assessment for today. What is your pain level now, right now?
0, no pain.
0 being no pain, 10 being maximum out.
0, no pain.
Okay, great, sir. Well, sir, thank you. So that concludes our health assessment today.
Thank you.
All
Very good.
right, thank
Appreciate
you.
it. All right.
Have a good one.
All right, thank you.
All right,
Bye-bye.
bye.